Hello, everyone. I am Lisa Anna Palmer, also known as the VP Coach, founder of Light Your Leadership Inc., author of the international best-selling book Light a Fire in Their Hearts, The Truth About Leadership, and the creator of LYLTalks. Today's topic hits close to home for me. I burnt out 3 times in my career and was diagnosed with fibromyalgia close to 20 years ago at the age of 34. As an executive coach with over 3 decades devoted to helping leaders, I know I'm not alone to have developed long-standing painful physical symptoms as a result of overwork, workplace trauma, and stress. For this reason, I'm looking forward to learning more from today's world-renowned guest, Dr. David D. Clarke. Dr. Clarke, welcome.
Great to be with you, Lisa Anna. I'm looking forward to our discussion.
Absolutely. I've been looking forward to this for a long time. So, before we dive in, though, a little more about Dr. Clarke. He is the president and co-founder of the Association for Treatment of Neuroplastic Symptoms, which was formerly known as the Psychophysiologic Disorders Association. He is also the assistant director at the Center for Ethics and clinical assistant professor of gastroenterology emeritus at Oregon Health and Science University in Portland. He is a professor, a clinical lecturer, an award winner named top doctor in his field. He is the author of the book, They Can't Find Anything Wrong, and has even made documentaries. So once again, Dr. Clarke, welcome to the show. It is an honor to have you on LYLTalks.
Thank you. I'm sure we're going to have a lot of fun discussing this topic.
Yeah, so let's dive in. So please share with us some highlights of your leadership journey and what brought you to where you are today.
Oh gosh, it started with very traditional medical training. I mean, it was as Western oriented as you could possibly imagine, completely normal medical school and residency. And I was cruising along. I got an award for excellence in medical school. I got into my dream residency program. I was passing my board examinations with high scores. So the last thing I expected was to run into a patient I didn't know the first thing about diagnosing or treating. And this was a woman who's referred to us from another university because they couldn't figure out what was wrong with her. I was at UCLA at the time. We did some specialized testing that others were not doing. And we were sure, my department chair and I, that this was going to show what her problem was. That test was normal too. I was doing her exit interview, telling her, I'm very sorry, you're going to have to live with this terrible condition you've got. And then, just so that it wouldn't be, all over and done with in 60 seconds, I started talking to her about stress. Other people had done that. They'd looked into that. She didn't have any. She was married. She had 2 kids. She was happily married, had a job that she enjoyed. But then I asked her about stress earlier, thinking, she'd been ill for 2 years. I thought, well, maybe something happened 2 years ago. And she started telling me that she'd been through a lot of trauma as a girl growing up. And this had stopped 25 years in the past. So it didn't seem likely that this could be connected to her illness, but it was a pretty severe trauma. It had happened multiple times, actually hundreds. And so I thought, well, we at least could address that. And I sent her to a psychiatrist that I knew at UCLA that had an interest in these brain to body connections, never thinking for a moment it would do anything more than help her to live with her terrible illness. But I ran into Harriet Kaplan, who was the psychiatrist, about 3 months later in an elevator ride. And this was the elevator ride that changed my career because Harriet had cured this patient just by talking to her for, maybe 10 sessions of counseling. And at that point in my career, I had no idea that such a thing was possible. But I thought, if I want to be a complete doctor, I should learn a little bit about this. It might come in handy from time to time. So I had Harriet teach me her framework. And I ended up using it 5 or 6 times a week throughout my career, over 7,000 patients in the last 30, 40 years, and eventually found others who had made their way to this same principles of diagnosis and treatment. We founded the nonprofit in 2011. I've been the president since that time, written a total of 3 books, 3 documentary films, give lectures all over North America and Europe, and trying to learn to be a business leader instead of just a physician. So that's, I think, how you and I hooked up at first was I needed some leadership skills to add to my medical skills.
Absolutely. And it was such a great meeting because we helped each other. You certainly helped me understand my conditions better in terms of the fibromyalgia and the burnout and what effect that had and what it might have been rooted in. So, you do such fascinating work. You've helped thousands of people who no one else was able to help because, I've experienced it myself. I've gone to the doctor says, oh, well, I explain my symptoms. Well, we can't find anything wrong with you. And it becomes so frustrating and invalidating. And because you have the symptoms, I mean, you don't feel good,
They're
right?
100% real. Yeah. And unfortunately, most medical professionals and mental health professionals, for that matter, are not taught how to diagnose or treat this condition. And so they are taught to look for organ diseases and structural damage, and they know how to do that. And when they don't find it and the patient still has symptoms, it's like, what do we do next? And that's what my nonprofit is all about, is helping people to look into the present and past stresses that are in somebody's life, and this affects leaders, it affects their employees. It's 20% of the adult population. It's 40% of all the people that go visit a physician with a symptom. And it goes much higher than that if the diagnostic tests are normal. So yeah, this is millions and millions of people, 50 million in the United States, probably, 4 or 5 million in Canada. And the good news is that it's got a solution. We've got now gold standard science, randomized controlled trials done at centers across North America, everywhere from Halifax to Los Angeles and many places in between, that show that the new treatment techniques are highly effective in alleviating this, just like that first patient that I mentioned.
Mm.
There's another patient, the first story in my first book, who had been hospitalized at a prestigious university 60 times in 15 years with no diagnosis. She'd seen a dozen specialists. She ended up in Portland and had one of her attacks there. And when I went in to see her, she basically tried to kick me out of the room and said, don't waste your time with me. I've had all the tests. They never find anything. They even had a psychiatrist evaluate her. She didn't have any mental health problems, which is, quite typical. My patients with this are usually mentally stronger than average. And so I just said to her, look, why don't you give me 30 or 40 minutes? I've kind of made lost causes a specialty of mine, and maybe we can come up with something. So she said, all right, if you want to, beat your head against the wall, more power to you. And her husband was sitting there and he looks down at his shoes and he goes, here we go again. But less than an hour later, we not only had a confirmed diagnosis, but she was basically cured on the spot. She never had another attack just by uncovering the stress that was in her life, that she didn't recognize the magnitude of the impact it was having on her. But all her attacks of illness, and she had between 6 and 10 episodes of dizziness and vomiting every year.
Wow.
All of those attacks were linked to, in her case, childhood stress. Her mother was verbally and emotionally abusive towards her and was still doing that. Patient was now age 50. Mom was in her 70s. Mom was still emotionally and verbally abusive, and her episodes of illness were linked to negative interactions, let's call them, with her mom. And as soon as she saw that, it made perfect sense to her. I still remember her looking up at the ceiling and saying, "Oh my God, I can't believe it."
That is incredible.
I
Incredible.
wish I could cure everybody like that, but
Well, I want to thank you personally for bringing this to the forefront, Dr. Clarke, because I know you've been on many shows and like you said, you've written books, made documentaries about this very important um, disorder, I guess that you can call it. It's so interesting because the mind body connection is so close. And especially when you have a chronic condition, you really feel it. Like, I'll give you an example. Just last week, I was finishing up a course on grief coaching. And so, as part of it, we had to think about our own grief and all that. And I've experienced a lot of loss in the last 20 years or so, like my dad, my grandparents, etc., cousins, even. And so after I couldn't understand why after I did like it was asynchronous course. So I watched a whole number of different videos closely together. My stomach was in a knot. It was in a knot. I had to eat baby food and arrowroot cookies for a day because and I was wondering what's going on. And then when I named it, I said, "Oh my gosh, I think it's because I brought all the grief back up to the surface and was dealing with it, that clearing it out maybe." And as soon as I had that realization, I handed in my paper and everything that I felt better the next day. Like I felt like brand new. So it's such a close connection that we forget about. And thank you for again for doing this work. Now, before we get into it a little bit deeper, would you be able to explain exactly what are neuroplastic symptoms?
Yeah, they are absolutely real symptoms to begin with. They are generated by the brain in the body, even when there's no structural abnormality or organ disease that's going on in the body. It's just purely generated by the brain. Anybody who's ever felt a knot in their abdomen when they're in a tough situation, I mean, let's say that you're going for a job interview, then you really want that job, and you might have some tension about how you're going to perform in the interview, and you get a knot-like feeling in your abdomen. That is a brain to body connection, perfectly real. Most of us have experienced that at one time or another. And this form of illness is just an exaggerated form of that. The stress level that people are suffering is at a higher level, even if they don't recognize it. It's going on for a longer period of time. And it can generate symptoms that are even much more severe. The level of severity was shocking to me as a physician, just how ill you can get from this. Like that patient with the, university hospitalization 60 times. That very first patient was that I mentioned with the trauma as a girl. She was averaging one bowel movement per month despite taking 4 different laxatives at double the usual doses. Another patient, 79 years of illness. Another patient, I was a teenager. I was asked to see on after they'd been in the hospital for 70 straight days, getting morphine around the clock for unexplained abdominal pain. You're never going to convince any of these patients that their symptoms weren't real,
Yeah.
and yet all of them were successfully treated.
Amazing. And I definitely get it. Like I said, back in 2009, I experienced a workplace, I guess you could have said like it was type of a emotional abuse by a senior leader. And then my stomach knotted up and clamped up and it stayed that way for 2 weeks. And I was not feeling good for 6 months. I even had to go to the hospital 3 times to get IV because I was dehydrated because I couldn't take fluid or eat properly.
Wow.
And they couldn't find anything. They gave me MRIs. They put me through everything, and they even gave me morphine, so I can relate. And then as soon as I changed roles. I stood up for myself. I made sure that things were put in place to address the situation. And over a couple of weeks, it started to dissipate, and my stomach started to kind of relax back into. But I did have to take medication for a couple of years though, for my stomach. But it really is. So basically, if I understand correctly, it's the brain is firing messages to the rest of your body and creating these horrible symptoms.
Yeah, and also, all pain is created in the brain. What you get if you whack your thumb with a hammer is a signal of damage from the thumb to the brain, and then the brain actually has to decide if it's going to have you feel pain in your thumb as a protective mechanism. But in certain circumstances, it will decide not to give you a pain signal. A classic example would be if you sprain your ankle while running from a dangerous beast. Your brain is going to say, "Look, you need to keep running until you get to a safe place. I am not going to inflict pain on your ankle until you're safe." And this happens in military combat as well. If somebody's wounded, they may not feel the pain until they are out of the dangerous situation. So it's actually a decision made by your brain to whether the pain is going to be created or not. And it can also send signals into your body that create all kinds of other symptoms too: tightness in the throat, difficulty swallowing, difficulty breathing. Certain kinds of rashes can result from this. Long COVID type of symptoms, brain fog, fatigue,
Mhm.
pain, pretty much anywhere in your body, often multiple locations, often pain that moves from place to place. but lots and lots of non-pain symptoms as well. I mean, this is literally from head to toe.
Wow, I never heard it explained that way. So thank you for illuminating us. So I imagine that a lot of the pressures and traumas people are experiencing in the workplace are affecting their health and with neuroplastic symptoms. What should leaders know about the impact of their leadership style or approach on people with neuroplastic symptoms?
Yeah, there is so much to unpack in that simple question there. The issues that create or that lead to neuroplastic symptoms in people, especially the severe and long-lasting ones, can often be traced back to a person's childhood experience,
Mm.
which may or may not be um, obviously bad, let's put it that way. Some people, like, my very first patient, her father molested her hundreds of times.
Mm.
And so that was, a very obvious trauma that she had in her life. But other people, it can be a lot more subtle. It can be just uh, never doing anything that is good enough to earn praise from your parents. One of my patients, the only time he got support and love and praise from his parents is when he did something better than his brothers and sisters could do it. And he had, unfortunately for him, three very accomplished siblings they were good academically, they were good athletically, they were good artistically. So for him to exceed them and earn that praise from his parents was next to impossible. And he suffered a significant drop in his self-esteem from that he carried with him for years, which affected his relationships with other people. And it made him vulnerable in the workplace to a toxic boss. So it was basically a toxic boss would reproduce his childhood environment for him. And because of that, it compounded the impact. If he'd come from a positive and supportive and loving childhood environment, he probably could have dealt with the toxic boss without suffering physical consequences from it. But to have that childhood experience repeated by the toxic boss just multiplied the impact exponentially for him and led to his physical illness that brought him to my office. So that's one of the major impacts, and there are more.
So basically, if a leader is behaving in certain ways that are more aggressive or not respectful, or they could be compounding, like you said, some of the traumas that the person has had, or they're reliving it through the way they're being led, and that leads to flaring
Yeah,
up.
just becoming symptomatic,
Okay.
which is actually the name of our website for that reason, symptomatic.me.
Mhm.
But yeah, you as a leader in a business environment will often have little to no idea the kind of background that your employee comes from. And these childhood adversities are very common. Somewhere in the range of 25% have suffered at least three adverse childhood experiences in the general population. And those can have long-term impacts on people that the supervisor or the boss in the workplace environment may not be at all aware of. Now, the long-term impacts can be positive in some cases. Many children survive this early adversity by becoming very detail-oriented. They try to fix the situation in their family by um, trying to support the people that are in that home, trying to do the best job they can, trying to be the best kids that they can. So as adults, they are often very detail-oriented, very hardworking, very compassionate towards others because they know what it's like to suffer themselves. And so when they perceive suffering in someone else, they'll often reach out to them and provide support. They're often very detail-oriented because as kids, that's how they responded to the adversity that was around them, trying to ameliorate that, make it, less impactful on other members of the family. So these are all great qualities to have. in an employee. We'd all appreciate having people like this be in our workplace. The problem becomes when all of those good qualities are taken too far, or any one of them is taken too far. You become so hardworking that you become a workaholic.
Mm,
And if you're a boss in that environment, you may be expecting everybody else to work at the same level you do. And in you, it's being driven by the childhood experience that um, drove you to work hard to solve those early problems. And the rest of the office is not going to have that driver going on. So there can be a real mismatch going on there. The detail orientation can turn into perfectionism, where no matter how well somebody has done their job, they're not satisfied with it. They just can never give themselves credit for a job well done. They can always find the flaws. They can always find some area where it could have been done better. And that's because when they grew up, they never had anybody make them feel good about something that they did. So they can't give that same feeling to themselves. And that contributes to burnout. It contributes to ultimately development of these physical symptoms. And all you might hear as the leader is that your employee is going off to see the doctors about something, and the doctors seem to be struggling to find something wrong. And it may lead to them being off work because of illness. And you may have just the barest hint about what might be going on to cause that. But it should be a red flag when you hear the doctors are not finding something wrong. Most of the time, it's not because there's a rare disease that is happening. Every once in a while, yes, it's a rare disease, and those tend to get written up in the newspapers. Oh, we couldn't find anything wrong with this person for months, and then we found this terribly rare disease, and we cured them. And you see that over and over again in the news media. But most of the time, if the doctor can't find anything wrong with today's powerful diagnostic tests, it's likely to be a neuroplastic symptom.
mm,
So lots of considerations for leaders to be aware of.
those are excellent insights. Thank you for sharing that. And also, I would like to add, for example, a leader has to check their behaviors too, because um, one of the things you mentioned is, the people who are with these kinds of disorders might be vulnerable. So one of the things I noticed is people who are hardworking and we call them workaholics, but maybe they don't know how to say no. And there are certain leaders who will pick them out and then just keep giving more work and more work and more work because, like you said, they do great work. They're perfectionists. They work hard, right? And the person doesn't know how to set those boundaries, so they'll just keep going until they burn out. I mean, that's in part what happened to me, was just not knowing how to say no at a young age. I mean, I've learned since then, but still have to keep myself in check. But certainly, as a leader, is be sensitive to that. Just because somebody is a great performer doesn't mean that you should abuse that opportunity, and really think about the person as a human being. And maybe they're not acting in their own best interest by taking on all this work, by saying yes to everything. So, and if it goes too far, then like you said, they'll start having to go see the doctor because all these horrible symptoms start showing up in their life. So thank you for that. And I also know, having been a coach for this long and working with people in the workplace, that leaders get these things too, right?
Oh, yes.
So what are, if a leader's going along and maybe they've been well for most of their career, but now the pressure's mounting with every step of the ladder that they go up, and all of a sudden they start to get symptoms. Like, how does that develop? And are there certain symptoms that you're seeing more frequently in leaders? What does that look like?
Yeah, and the leaders can get pretty much anything that everybody else can get, and definitely the workaholism and perfectionism are, those are the kinds of people that are promoted. They have very high capacities for work. They pay attention to details. They get things done, and they get promoted, which is great for them. But one of the questions that I commonly ask my patients, and that a leader could ask of an employee that they're concerned about their workload, and that they can ask themselves, is, what do you do for fun?
Mm.
Um, what kinds of activities do you have in your life that have no purpose but your own joy? One of my patients was a woman who in her 30s, and she just her answer to that question was, "Well, I'm not really sure." And she was, working full time. Her husband was working full time. She had two kids. She had been an athlete as a girl, and she was coaching her kids in her sport. She was coaching other people's kids in the sport. She was on the board of directors of the athletic club. She was driving kids to out-of-state competitions. And and when I asked her what she did for fun, she just, like, there really wasn't very much. Maybe she got out to watch a movie with her husband every other month or something. But other than that, it was nonstop. She was living on a treadmill that she never stepped off. And where I met her was in the emergency ward early in the morning. She'd been there all night because she'd had this sudden attack of severe abdominal pain. They did all the tests, everything normal. And I'm just talking to her about this, and it was clear that her body had just hit the wall. It was just finally saying, enough. We are not doing this lifestyle anymore. I'm going to make you hurt so bad that you have no choice but to stop. And that was what was going on there. And a lot of my patients who are living like this, you can trace it back to when they were kids. And it's not necessarily an abusive environment, or, in place where, parents have drug or alcohol issues. It's not always so obvious. And this woman, she had been a champion athlete as a girl, but to get there, she had to do her sport before school, after school, and on weekends, starting at the age of 4, and continuing on up until she was 18, and she finally stopped doing the sport. But for 14 years, she really never got to be a kid. She was a little workaholic, 6-year-old, 8-year-old. And so naturally that carried on into the adult years. And
Mm.
only by understanding that connection to the past was she able to make some changes. And my treatment for this is for people to learn this essential human skill of just learning how to play. And I asked her to take, if she possibly could, an afternoon off every week. And fortunately, her husband was very supportive. He was going to, pick up some of the slack around the house so that she could actually do this. And all she could think of to do was go for walks in a park. And, even that made her feel a little guilty, not doing this and not doing. But I assure people, all you are doing is putting yourself on the list of people you take care of.
Mm.
Um, and people who are in this situation, they have trouble coming up with something that's fun for them. I'm looking for, again, time spent with no purpose but your own joy. But, walking in the park was better than what she'd been doing before. And while she was walking, she was thinking. And after about 6 weeks, she came up with the idea of taking piano lessons, which she'd never done anything musical before. So it was a bit of a surprise, but she absolutely loved it. And that was when her pain finally went away.
I love that. I love that. And I agree with you. I hear it all the time. When people are stressed out and I ask them, well, what do you do for fun? And it's like, I don't remember how to have fun. I haven't had fun in 20 years, ever since I started working, and hence the effects. Now, a question. So a lot of it is anchored in childhood. Now, could it be like, for example, if somebody is feeling fine, but all of a sudden they start working in a toxic organization for 4 or 5 years and they're being mistreated, could that be the point where that anchors in and then leads to future symptoms?
Yeah, it doesn't have to be linked to childhood. My most severely ill patients, it was, but doesn't have to be. It can be any stress that's going on in your life right now, especially if you're not recognizing the magnitude of it, the impact of it. Very simple diagnosis that I had was a man who had 9 months or so of unexplained pains. But this again shows the deficiency of the training of us medical professionals. Nobody had gotten the exact story of when and where he was having his pain. And it turned out he was only having the pain when he was driving to work.
Mm.
When he was driving home from work, he was fine. Uh, on the weekends, when he was not at work, he was fine.
Very
So
telling.
that kind of tells you something, right? I mean, you don't need to be a physician to diagnose this gentleman. And so I asked him, what's going on at work? And it turned out he was in a two-person office in a big corporation. Just, he and his partner were doing the work of this office. And the partner was transferred to another office in the same corporation, 1,500 miles away. And suddenly his workload doubles. And when did this happen? 9 months ago.
Wow.
So by showing him the connection, it was a great relief to him that there was finally an explanation for why his stomach was killing him. And it empowered him to go to his supervisor and say, look, this is not sustainable. We need to find a solution to this. And just knowing where the pain was coming from was provided a significant amount of relief to him. And then working with the supervisor, they just had trouble, hiring a replacement for the person they transferred, but they were able to do some workarounds and give him a break. And he got better.
That's amazing. And so, are there any early warning symptoms that people should pay attention to?
It's strange how this can just come out of the blue. You can be perfectly okay one day, and then the next day, you've got, migraines coming on, or your belly is hurting, or your bladder's in spasm, or your back is hurting you. It just is like the brain reaches a limit, and then it has to. It's actually trying to be your friend. It's communicating with you with these symptoms. Even when somebody's really hurting or really having a bad digestive issue, it's actually your brain trying to be your friend and communicate to you in the only way that it knows that there is a stress going on, a source of difficulty that needs attention. And you may not immediately know what it is. We've got a 12-question quiz on the symptomatic.me website that helps screen people for what these issues might be, points them in the right direction for uncovering some of these things, because it's usually a stress that you don't appreciate the full magnitude of it. And if you've grown up with lots of stress, it may just feel perfectly normal to you. If you grew up with a toxic dad and now you have a toxic boss, no big deal. It's what you're used to, and so you may not appreciate what your body is trying to tell you in that situation.
Mm, that's so interesting. And so, you know, what if someone realizes they're starting to not feel well, and having a difficult time, and either in their personal life or at work due to these neuroplastic symptoms? What can they do to improve their circumstances?
Yeah, absolutely. The first thing to do is to make sure you don't have an organ disease or a structural damage in your body. You always want to assess for that. And people who go to the doctor just walking in the door, if you with a symptom, you've got a 40% chance that it's got a neuroplastic cause. Then when the diagnostic tests come back normal, the chances of it being neuroplastic are over 90%. So then the next step is to be looking for, okay, if my brain is trying to tell me there's a stress going on, what might it be? And you may have some ideas already about stresses that are going on. You just may not recognize how big they are. So a good exercise is to sit down and make a list of all the stresses in your life, not only in the present day, but also from the past, to see if you can get a complete idea of what you might be struggling with. And just the writing down can often get people's brains working to recognize the power of some of these issues. And of course, the 12-question quiz that I mentioned is another way to gain some insight. Each of the questions has a sentence or two to explain what the meaning of the question is. And it's arranged in a way that the more questions to which you answer yes, the more likely it is that you have a neuroplastic cause for the condition. So, is it workplace stress? Is it stress at home? Is it with a family member or a neighbor? One of my patients was the deacon of his church, and the church was having this big dispute about some point of biblical doctrine, and they were splitting up. Half the church was leaving, and when this happened, that's when he started having the symptoms. So there's a whole range of different things that can trigger this. And he had no idea that this was behind it until I showed him that his symptoms began at just the time when the church was breaking apart.
Wow, you're doing such incredible work, and I love that you're getting the science to back it too, because that's so important. It's so validating, and it's good news because it says, your symptoms do exist and you can do something about them.
Yeah, the pain relief psychology that's being studied now is so far beyond what we had available in the past. Most psychotherapy is cognitive behavioral therapy or something related to that, which just simply isn't effective for this condition. You need to get into emotions, trauma, um, adversity in childhood, the long-term personality trait impact of those things, triggers in a person's present day life that are linked to the past, unrecognized anger or fear that's happening in a patient's life. And when you do that, the results are remarkable. The Boulder back pain study, they had 50 people with an average of 10 years of low back pain. And what those patients got was two 1-hour sessions a week for 4 weeks of pain relief psychology. And their pain scores dropped from an average of 4 down to an average of 1 in 1 month. This is after like 10 years. You can just imagine my hand going, way off to the
Yeah.
side here of pain. And in 1 month, it drops from 4 to 1. It was, and they had two control groups because, it was a randomized trial. And the control groups, had very little change in their pain. And one of the control groups got this big injection into the spine. You would think that would do something, but it was nowhere compared to the pain relief psychology.
Wow, that's such incredible work. And so what's next for you, Dr. Clarke, and the Association for Treatment of Neuroplastic Symptoms?
Well, we just had our first live conference in September of 2024. And we were hoping for 250 people. That was our wildest dream. And we ended up with 270. So it was a tremendous meeting. And I know your viewers are familiar with Net Promoter Scores. The Net Promoter Score from that conference was 80, which, we were just overjoyed with. For those not familiar, 40 is about average and it's still considered good. But to get 80 from the people who attended. So we're going to do it again next year. We're going to have another conference. We're going to be launching some podcasts of our own in 2025. We are supporting research. We've got a couple of new books coming out. We've got online training courses that are already available, and we're going to be adding to those. I'm continuing to do speeches to professional groups to teach them about this, but also the public. Going to be speaking in London in May, for example. So lots and lots going on. We've got a big job ahead of us because there are, in the United States at least, well over 1 million healthcare professionals, and the number that actually know how to do this work is in the hundreds. So we have a lot of training to do before this becomes the standard of care.
Mm. Well, I wish you all the best in this journey that you're on with your team and all the people you are helping. It's just incredible. It's mind-blowing, really, to think about the potential here for healing people who, especially people who have basically been given no recourse, and here you are with a protocol and approaches and tons of resources to help with that. So again, it's on your website. How can people reach you?
Yeah, it's symptomatic.me is the website, and the 12 question quiz is there. We actually recorded this conference that we had in September of 24. We recorded the two virtual conferences before that. The training courses are jargon free so that people who are not healthcare professionals can understand all the content that's there. We have a membership program. People who support us as members can join us for question and answer sessions via Zoom every month. And there are lots of other benefits for our members as well. So we would, love to have your viewers come check us out.
Oh, excellent. I highly recommend. So any last words of wisdom for our viewers?
Just that there's a tremendous hope for this. The Even people who um, were ill for decades were able to recover using this approach. The insights that people get into the long-term impact of adversity in the past can change not only their physical symptoms, but also their personality traits, their relationships with other people. The individuals who are toxic for them tend to get pushed out of their lives, and much better, more positive, supportive, mutually supportive relationships start to appear for people. So it not only makes your physical symptoms better, but it has impacts on your life as a whole.
Mm. Thank you again, Dr. Clarke. From the bottom of my heart, I know that you've given hope to myself personally, to all the listeners who are suffering right now, who have never heard of this before, and now they have additional information and ways to contact you to get help. So thank you again for joining us on Little Talks.
Thank you, Lisa. It's been a pleasure.